Thank you so much, Vanessa, for having me. Thank you all for being here. I'm really excited to be here and presenting a little bit on mindfulness. So I am coming from a few different angles when I speak. So I started practicing mindfulness about 15, 16 years ago when I was in college. Found it really helpful in my own life and then started studying it more in a kind of academic way. After that, I was a special ed teacher for a couple years, working with kids in that setting. Went to graduate school for clinical psychology and became a clinical psychologist and did a lot of my research on mindfulness with kids, which was sort of just kind of starting at that time. Most recently, my role with kids is I became a parent about 10 months ago, which has been really exciting for me, but unfortunately means I do need to zip out of here right after my talk, and there won't be too many slides of my son on the slideshow, I promise. But there may be one at the end. So I do a number of things. These days I do a lot of consulting in schools. I do a lot of work with parents. I teach at Harvard Medical School. I teach at Lesley University. I lead workshops like this around and also work as a clinical psychologist, like one-on-one with kids and occasionally doing some mindfulness groups with kids and young adults as well. So I'm really excited to be here sharing a little bit about what I know about mindfulness, both as a clinician and in terms of some of the research. So I've been kind of tasked with introducing a little bit what is mindfulness. That's a little bit what I'll be speaking on today. Sharing a little bit about what are the benefits of mindfulness to ourselves as well as to kids. And then we'll be doing a few practices throughout so that we can get an experience of mindfulness. Because I know probably a lot of people here do have a lot of experience with mindfulness, and some people may be relatively new. But mindfulness is something that we can talk about, but until you really experience it, it just doesn't quite make sense in quite the same way. But let's start by kind of trying to define mindfulness. So we're all here for a reason, to learn about mindfulness. So what is mindfulness? When you hear the word mindfulness, what do you tend to think of? What associations or definitions might you have?
Being present.
Being present, absolutely. Really big part of it. Yeah.
Awareness?
Awareness, really a big part of it. Yeah.
Without judgment.
Without judgment. All right. I used to do this and it would take 10 minutes to get to the definition. Now everyone knows what mindfulness is. And so I'll share a little bit about what I like for a definition, and I'll say why mine's a little bit different. So paying attention, which is basically awareness, right? As someone said. Now, how many of us have ever been told to pay attention? Okay. A few of us. I'm sure that was, and I'm sure we've never told our kids, to pay attention or anything like that. And it's probably not always been said in the kindest of ways, right? So a lot of us have been told to pay attention or told kids to pay attention. How many of us have ever been taught how to pay attention? I see 0 hands and no laughs for that one, right? So one of the things that's happening that we're doing all the time is we're telling kids to pay attention. We're asking them to do something that we never have taught them how to do. And they need to pay attention, right, in the classroom, at home, in their conversations, in their relationships, in all parts of life. Paying attention is incredibly important. So one of the first things that we're doing in teaching kids mindfulness is we're teaching them how to pay attention. That's a really big part of it. Then there's this second piece that someone else mentioned, the present moment, right? And as I said, I've actually been practicing mindfulness for, I know I look like I'm 22 years old. Mindfulness keeps you young, I guess. But the present moment, I've been kind of hearing about it for a long time, and it never really clicked for me even until just a few years ago when I realized, oh, if I'm in the present moment, my mind's not stuck in the future, worrying, right, with those horror stories we tell ourselves or our kids tell ourselves, right? That's where a lot of really bad stuff happens, is in the future, right? Or sometimes it can go to the past, where for some of us we've had some bad experiences, maybe. Or for some of our kids, they've had some bad experiences. And it doesn't even necessarily have to be some kind of major trauma. It can be, maybe they're trying to sit in class and they're just feeling so embarrassed about what they said at the cafeteria table just a few minutes ago, and they can't really be focusing on the present moment. So we're teaching our kids to come into the present moment. And the other thing about the present moment is it's this opportunity. We can rest. I don't have to think about the future. I don't have to think about the past. I can just kind of rest in the present moment. It's an opportunity. And then the third part of this is, that someone else mentioned, is this piece about acceptance and non-judgment. Right? And this is really critical to teach as well, because I think for a lot of us, we have, we're kind of like a high-achieving room of people, I'm guessing. We have that kind of critical voice sometimes that tells us that we're not good enough, or we're not smart enough, or we're not doing a good enough job, or something like that, right? So we can start to quiet that voice with some self-compassion in some ways through mindfulness. Accept ourselves a little bit, or maybe our kids have internalized some voices about kind of who they are, or aspects of their identity, or maybe some teachers or other folks in their lives, they've internalized some critical voices in that way. So teaching them some acceptance, self-acceptance. So it's self-acceptance is part of it, and just accepting kind of what's happening in the present moment. Okay, this is just what's happening, not having to fight it in quite the same way. And also stepping away from that judgment, that self-judgment and that judgment about what's happening in our experience. That judgment that comes up right away when we start to practice mindfulness and we say to ourselves, oh, I'm not good at this. Like we can learn to kind of step away from that, quiet down that self-judgment in a lot of ways. Of course, acceptance and non-judgment are they're kind of big words for like a 5-year-old, right? So we can also think when we're thinking about talking to kids about this stuff, maybe kindness and curiosity are actually the better words we might want to use than acceptance and non-judgment when we're talking to some kids. And that's also what mindfulness is about. It's getting curious about our experience. What is this emotion I'm having? What is happening in the world around me, not just what's happening in the screen in front of me or something like that. So to me, I have this kind of wordy definition of mindfulness that I like to share, but I also like to divide it into these 3 parts, because what we're doing when we teach kids anything, right, we're not starting out in kindergarten with like calculus, right? We start out with 1 + 1. And so with mindfulness, we can kind of break things apart as well. So we can teach kids practices that are about attention. We can teach kids practices that are about present moment contact, right? And to me, that's often using the body, as the person who introduced me just said, right? So like our thoughts are racing to the future or back in the past, but our body, our 5 senses are always in the present moment, right? Like that brought us all right into the present moment, right? So we can use our senses to come into the present moment. And then this piece, we can also be teaching kids practices about acceptance and about non-judgment and about kindness and curiosity with their own experience. So to me, that's why I have this particular definition of mindfulness in these few different parts. Of course, we also all know, whether we're teachers, whether we're parents, whoever we are, that not every kid is super verbal, right? So we can define mindfulness in some other ways. So maybe we want to define mindfulness with something like a picture, right? So what do you notice about some of the differences between these 2 beings here? What's going on?
The dog is clutter-free.
Dog is clutter-free, being mindful. Anything else?
Well, it looks like it can't be both.
It's hard to be both. Yeah. And so what I see in this picture is, the dog is seeing what's actually here in the present moment, right? He sees the sunshine and he sees the trees. The human actually doesn't even see that because he's so wrapped up in the past and the future and emotions and all of that. So the human's missing out. The dog's actually seeing it. The dog's actually, and is also not sort of made unhappy by all these different thoughts. And I think this is a great example. At the same time, we are human beings, right? We're not dogs. I mean, I know some of us probably wish we were. This looks like a pretty good life, right? But, we do have to plan things. And we do have to think about things. And we do have to learn from our past mistakes and all of that. And so what we want to actually be doing when we're teaching ourselves and teaching kids mindfulness and getting in touch with the present moment is we're not just being like the dog all the time, but we're learning how to switch between those 2. Because too often we're walking around like the human being, right? In this picture, kind of thinking about the past, thinking about the future, missing out on what's actually here. And what starts to happen, and I'll share about this in a few moments, is the more our brains are like that, thinking about what we don't need them to, the more they're going to be like that. The more we worry today, the more I'm going to worry tomorrow. And that's what's happening in the brain. They say neurons that fire together wire together. We rewire ourselves to be stressed out all the time when we don't need to be. So that's what we're doing with mindfulness, is learning how to shift gears and teaching our kids how to shift gears. So a little bit, kind of moving on a little bit further, I want to say a few words about stress. So last year, the American Psychological Association did a big survey of Americans to see who the most stressed out people in America were. I don't know why they did this. They wanted to find out who was stressed out. And what they found was that the most stressed out group in America is the American teenager, followed closely by American kids. right? It's actually not us parents. It's not us teachers. It's not us therapists. It's our kids are the most stressed out group in America. At the same time, we are not giving them very many stress management skills. We're cutting recess down, right? We're busier than ever. And the best way to create stressed out kids is to surround them with stressed out adults in a lot of ways. So our kids are more stressed out, fewer skills, and then we wonder why we're seeing like record rates of mental illness at the same time, and learning disabilities, and behavioral problems, and aggression, and violence, and all these other things in our kids today. So one of my kids sent this to me, and I don't know if people can read the slide very well. I need to get a better copy of this image. But it says, the student paradox, pick two. You can have good grades and a decent amount of sleep, but then you have no friends. Decent sleep and a good social life, but then you're failing all your classes. Good grades, good social life, then you're never getting any sleep. And doing all three is basically impossible. Right? This is how a lot of adolescents feel. This is how a lot of adults feel. Right? And this doesn't even include, like I'm being raised by a single parent, or I have a chronic illness, or a mental illness, or a learning disability, or ADD, or all the other things that our kids are faced with today. Right? So there's a number of different ways that we can respond to stress as human beings that are wired into us. And I want to kind of take us through a few of these different ways we respond to stress, and then talk about where mindfulness fits in. So unfortunately, this is going to be an experiential exercise, so I'll ask you to do this along with me. So what I want you to do is just hold out your hands like this. You can have your eyes open or closed, and just make fists as tightly as you can. Oops. And just notice what this feels like as you make these fists. What's happening in your body? What's happening to your breath? Are there times that you tend to feel like this? How open or closed do you feel? Physically or emotionally? And then just let go. Notice what that's like. Now I want you to kind of slump over in your seat like this. And again with these same questions. How does my body feel? What's my breath like? How awake, alert, how open or closed? Are there times I might feel like this? And then just sitting up, a little more straight, kind of in the middle. Hands like this, open. Again, asking yourself these same questions. How's my body, my breath, my mind? How open, how awake? And then just put one hand on the other. Rest these both over your heart. Noticing these sensations. Asking yourself these same questions. And you can just put your hands down if you like, and just bringing your attention back. So, just to reflect on that exercise, what did you notice when I had you make these tight fists? I think I said, what's your body feel like, your breath, how open or closed, some things like that. Any comments? No right or wrong answers. Yeah? Pardon? Started to hold your breath. Yeah? Yeah?
That's what I was, the breathing, it was, I started holding and then it hard to get deep breaths.
Hard to have deep breaths. The breath gets a little bit more shallow. Yeah. What else?
My hands hurt.
Hands start to hurt. Yeah. Yeah. Gets tiring after a while. Yeah.
Tensing my arms, my body.
Tense. So you start tensing a little bit. The rest of you starts to tense up. Yeah. Any other comments?
Felt like my thoughts were indistinguishable from one another.
Thoughts started to kind of run together a little bit more. Yeah. Yeah. One more comment. Thought I saw one more hand.
I thought it was interesting. I sort of conditioned myself to remember to breathe.
Uh-huh.
But as I was, watching my breath, I noticed that my jaw started to clench.
Jaw started to clench.
Coming out somewhere.
Yeah. Yeah. Absolutely. Absolutely. So then what we did was we kind of collapsed over. What was that experience like for people?
I don't know why, but I just thought about my kids feeling like this.
Kids feeling like that. Yeah.
I hope they
Yeah.
don't, but that's what came to mind.
Yeah. Yeah. Notice your breath, or how your mind felt, or how awake you felt in that position.
I did not feel awake.
Pardon?
Did not feel awake.
Did not feel awake.
Very
Right.
sluggish.
Yeah, very sluggish. Yeah. Yeah. So a few different things are happening. What I'm kind of having us do is I'm sort of simulating the responses that we human beings have to stress that are wired into us from an evolutionary perspective. People may, think back to college, remember the fight or flight response. That's what this is, fight or flight, right? There's a stressor, maybe it's a, saber-toothed tiger chasing me, or maybe it's I have an exam next week, or maybe it's my mom's yelling at me, or maybe it's my kids yelling at me, right? And we go into this mode, or someone cuts us off in traffic. And what starts to happen? Some different things start to happen in the brain, in fact. So our prefrontal cortex, which is where we do our big picture thinking, it's what kind of makes us human beings, our prefrontal cortex, that totally shuts down. Our amygdala, which is our more kind of primitive caveman, Incredible Hulk brain, that gets really active. I want to fight or get the heck out of that situation. Other things are happening. Cortisol, which is the stress hormone, that starts pumping through the body. Oxytocin, which is like the love hormone, the warm and fuzzy hormone, people might have heard about that, that actually shuts down because cortisol blocks oxytocin. So we can't actually be both stressed out and kind of loving at the same time, right? So we're actually not able to kind of like solve that complicated math problem, right? We're not able to think clearly. We're not able to see the big picture. And our brains are kind of putting on a filter that says everything is a danger right now. So even if you're like a lovely, nice teacher or nice parent and you're trying to talk to your kid and they're in this state, nothing is getting through. Everything looks like a danger to them. They can't see that in different ways. So that's some of what's happening. People notice also, like you start to tense up, the rest of you starts to tense up. Our breath gets more shallow, right? We need that if we're going to escape from a situation. But the other thing is that we kind of, for a lot of us that are maybe new to mindfulness, we hear all this, oh, is it about breathing or something like that, right? Well, actually, the breath gives us a lot of really good information about what our emotional state is. If our breath is shallow, that's telling us something. If our breath is more easy, that's giving us other information. So the breath can be a barometer about what's going on. It can also change how we feel. So then we slumped over. That's more of like the freeze or submit response, the give up response, right? Maybe we see some of our kids, maybe feel like this, like on Friday afternoon or something like that, just kind of burned out, nothing left to give, no more energy. It's another response to stress that we can have. And then we shifted a little bit more to a few other positions. What did people notice when I had you go like this? Calmness, relaxed. Breath returned. Anything else? How open or closed or awake or alert? More open, more alert. Okay. And so that's really kind of mindfulness, basically. Mindfulness in our bodies, mindfulness in our brains is what's happening. That part of the brain, the prefrontal cortex, that's kind of coming back. The amygdala, the like Incredible Hulk brain, that's quieting down. Right? And this is also, I like this exercise because it shows that mindfulness is not passive. Right? These practices don't turn us into slugs or turn us into doormats or turn our kids into those things. They're actually, like, this requires a little bit of effort, right? This is awake, this is alert, right? This is open. Right? This would be a better way to, we'd love it if our kids were like this when we were renegotiating a bedtime or, when they're going into the MCAS or something like that, right? This is a little bit better. More is flowing in, more is flowing out. And lastly, we did this posture. What was this like for people? Comments?
Self-care?
Self-care. Yeah, this is really like a gesture of compassion or self-compassion. It's another way that we can respond to stress or to something happening, whether it's an exam or whether it's something terrible happening. I was away in Finland doing some of these workshops when the marathon bombing happened, right? And my first response was just to grab my chest, right? It's like compassion, self-compassion. How's everyone back home doing, right? These are natural responses. Mindfulness and compassion, self-compassion, these are actually as natural responses as the fight or flight and freeze mechanisms. We just don't choose to cultivate them in ourselves. Like fight or flight, those are just like a shortcut. But we can actually choose these other responses. And researchers, I might talk about them as mindfulness and compassion, but researchers might talk about them rather than fight or flight or freeze as attend and befriend. Show up for your experience. Be compassionate with yourself and the other people in the stressful experience. right? And so what else we want to do is kind of not, if we're like this all the time, if our kids are like this all the time, our brains start to rewire, right? So that we're like that more of the time. I said that a few minutes ago. Some people might call that karma, some people might call that neuroscience, but that's just what starts to happen. But we also looked at the breath, the way the breath changed in these different postures. So as I said, the breath can be a barometer, the breath can also be an object of attention, and the breath can also actually change how we feel. We can change our breath and then change how we feel. And so when we're working with kids, or teaching our kids anything, we want to kind of make it fun. We want to make it playful, right? I approached some kid a number of years ago, and I was like, have you ever done deep breathing? I was like all jazzed, I'm like, I'm going to teach all the kids to breathe and save the world, right? When I was like a lot younger. And he was just like, yeah, breathing is played out. And I was like, okay. But we want to find some ways to make breathing a little bit more interesting, a little bit more playful. So instead of saying, take 10 breaths, maybe we want to do a visualization exercise. So let's do a little visualization together. So you can hold your hands like this if you want. And maybe imagine that you're holding a bowl of soup or a cup of hot chocolate, and it's really full to the brim, and it's really hot, and so what can we do if we want to cool it off? We have to blow on it, right? So let's breathe in through our nose as if we're smelling the hot chocolate. Let's breathe out through our mouth as if we're just blowing to cool it off. Not so hard that it spills. Breathing in once more. Breathing out. Let's do a third hot chocolate breath. So I'm a therapist, so it's my job to say, and how does that make you feel? But I am curious. How do you feel after 3 breaths? Relaxed? Calm?
I notice that every time I put my hands out, I sit up.
You sit up a little bit more too. Yeah. Any other comments? Yeah.
I wasn't thinking about anything else.
Wasn't thinking about anything else. Yeah. And so what we can do is we can use visualizations, we can use our 5 senses to engage kids rather than, even it's for us adults it's hard, right, to like focus on our breath for any period of time. But we can use visualization. So there's a child development specialist from sort of the mid-century Russia, Lev Vygotsky. Some people might be familiar with his work, but he was doing this experiment where he was trying to get like 8-year-olds to stand still, which is a pretty tough thing to do, right? So, he was like, okay guys, I want to see how long you can stand still, and he gets out his timer, and so like 3 minutes goes by, and they're like running around all over the place, right? But this is like Soviet Russia, so he has to like get these kids to stand still and be good comrades or whatever. So he's trying to think about how he can get them to stand still, and he says, okay guys, I want you to stand still, but this time what I want you to do is imagine that you're the guard at a factory, or imagine that you're a knight guarding a castle. And what do you think happened? Kids could stand still for like 3 times as long, 4 times as long, right? So we can tap into the power of imagination with kids and get them to sit still, or make it a bit of a game, right? And we do this all the time as teachers, as parents. It's like, oh, let's pick up all the blue toys, and let's pick up all the red toys, and it's better than like, pick up all your toys, right? So we can think about how to make it kind of fun, think about how to make this stuff a game, bring in visualizations, bring in things that they're already familiar with, they're experienced with. Everyone knows what it's like to breathe in like you're smelling the soup, or blow just enough that you're not spilling it, right? So it's not this weird thing, it's this fun thing, right? It's hot chocolate. I love hot chocolate, and I've done this workshop different places, and it's also really fun because different kids, you can have them pick their favorite food. So I was in Poland and we did like borscht breathing. And I was in England and we did like tea breathing, and we did like rice porridge breathing when I was in Asia once. So like we can bring in different kinds of things for kids to visualize in different ways. So that's one way to make the breath maybe a little bit more interesting. Another one, that's the hot chocolate breath. Another one that I learned, this actually learned from a really lovely curriculum called the Mindfulness in Schools project. It's sometimes known as .B. It's a school-based curriculum out of the UK, and they do a number of trainings actually in Massachusetts, if you're interested. But they have a practice that they didn't invent, but it's called the 7-Eleven breath. So whereas younger kids might like the hot chocolate breath, and actually older kids like the hot chocolate breath too, the 7-Eleven breath might be a little more interesting for maybe like middle school aged kids. And I did some research on this practice. What's cool about it is that it's actually developed or used a lot by first responders. So for like those boys that are maybe a little bit like, oh, what's this, weird breathing thing? It's like, well, actually, these like firefighters and ambulance drivers and policemen, they're like running to the scene, of the, where they're rescuing someone, and they need to stay calm, and they need to help the other people stay calm. And this is the breathing practice they use. So it's a way to maybe get a little bit more buy-in with some of those kids that might be a little bit more skeptical. And it's about as simple as it sounds. We can do this together as well. It takes a little bit of practice, but we breathe in for a count of 7, and then we breathe out for a count of 11. So let's do this together, and just find a nice, comfortable, upright posture. Again, with visualizations, maybe just imagine a string coming out of your head. Maybe imagine that you're a king or a queen sitting on a throne. Then let's just breathe in for 7. And out for 11. One more. And out. And then one at your own pace. Just open your eyes and let your breath return to its regular pace. Any comments or questions about that? Yeah.
Would you just start this with the kids at 7-Eleven? Is that something, like, personally I've had to work up to? That's long.
Yeah, and 7-Eleven it is a little bit tricky. Like the counting is that the first time you do, you're like, what is your? I was just okay. Like I think some people may have had that experience. So it does take a little bit of practice. For me, it kind of really depends on the kids I'm working with. I work with all different kinds of kids, and I work sometimes in a mental health setting. Sometimes I'll go into a school. It kind of depends on who the kids are, how old they are, and what the situation is. But this is really great. Kids that are struggling with anxiety, kids that are struggling with panic, kids that are struggling with stress, right? Like, let's do 3 7-Eleven breaths before your test tomorrow. Before you get on stage to do your solo in the school musical, do a few soup breaths, something like that, right? So finding those times and then delivering the practice to the kids that they can kind of bring it into wherever might be useful. Maybe you just do it before dinner in your family, or before bed, or as you're packing your bags for school, something like that. Any other comments? Complaints? Haters are welcome? Yeah? Pardon?
Does it work with children with ADHD?
The question was about children with ADHD. So these practices are really helpful for kids struggling with ADHD, ADD, attention issues. So what some of the research has found, and it's a lot of research that's been going on here at Mass General, Harvard Medical School, places like that, is that it really makes a difference in terms of different kinds of attention and executive function. So sustained attention, which is the ability to kind of keep our minds on one thing, right, and not have them wander, pay attention to what we're supposed to pay attention to and not pay attention to those other things like the spitball going past or whatever it is, right? And also selective attention, like switching from paying attention to this to paying attention to that, right? Kind of moving our attention from place to place, which is also really important, right? And ADD is not, in fact, about a lack of attention. ADD is about too much attention. It's going here, it's going there, it's going, I'm hearing the lights buzzing, I'm looking over there, I'm looking at that guy, like that's what ADD is. So where mindfulness fits in terms of attention training is it changes the prefrontal cortex, which is the part of our brain where we do our attention, and helps us with both the sustained and the selective attention. So yes. Now getting kids with ADD to do these practices is a different story. But I think when we make it fun, when we make it something like a game, when we don't make it kind of too much work, then it becomes a little bit more interesting. They can start to train themselves and change their brains. Yeah. So another practice that can be I'm looking for my box of toys down here, that can be another kind of way to visualize mindfulness a little bit, or visualize the breath rather a little bit, is people know the Hoberman spheres. This is like a toy you can get online or at like an educational toy store or something like that. And it stretches out, and it's colorful, and it also stretches back in. Vanessa, can I have you come to a demonstration? She didn't sign up for this. I'm going to put her on the spot. So what we're going to do is we're going to pass the breath back and forth.
Okay.
So I'm going to take a breath and expand this. And I'd like for us to do this together. Let's all focus and share the breath together. And I'm going to pass it to Vanessa, so be careful, it can lock up if you breathe in too deeply. Now we'll follow Vanessa's breath. Thank you very much. Thank you, Vanessa. But it's another way we can think about a breathing practice that's maybe a little bit more fun, that brings in a little bit more visualization than just like, oh, go do 10 deep breaths or something like that, right? That doesn't sound like fun to me. You know, it certainly wouldn't sound very fun to a 7-year-old or a 10-year-old with ADD or something like that. But when we can make it fun, we can kind of share the breath, right? Maybe in a group, maybe in a classroom, you know, instead of taking 20 deep breaths as a classroom, you know, just take this and everyone gets a chance to take one breath and pass it. We're all then also noticing kind of how everyone's breath is a little bit different, right? We can kind of see a little bit of what that's like as well. So it's another way to make breathing a little bit more concrete in some ways, which is helpful for kids. Another practice that can be fun with some older kids, we probably, you know, we know that letting out a sigh can be a really nice way to, you know, a sigh of relief or a sigh of exasperation, right? A sigh is a way to express some emotion. So we can, as a group, maybe let's take a big loud sigh together, like, all right. But then we've probably had the experience of like kids like sighing at us, right? Which is like kind of insulting. And so one thing I like to teach adolescents is like, well, you can sigh at your teacher, at your parents, but maybe you want to do a really long, really silent sigh to let out all that exasperation. It's kind of passive aggressive. They don't have to know that you're doing it, right? So we can do this together. We can take a breath in and then let out a really long, silent as possible sigh together. Do those instructions feel clear? Okay. So let's breathe in. Long, silent sigh out. All the way to the bottom of the breath. And then we can just allow our breath to resume whatever the normal pace is. Right? So we can kind of let go of some of that emotion as we go all the way down to the bottom of the breath in that way. And all of these are practices. You could do 10 minutes of 7-11 breathing, or you could just do 3 7-11 breaths, right? You could do 5 silent sighs if you need 5, or you could do 1 if that's all you need to kind of let out whatever that energy is. And both the silent sigh and the 7-11 breath, you might have noticed, these are about breathing in for a little bit shorter and breathing out for a little bit longer. When we breathe in a sort of shorter to longer in-out ratio like that, what that actually does is that calms down the nervous system. So it settles the nervous system, it settles the brain a little bit at the same time. We can actually reverse that, like if we're feeling a little like sluggish, like Friday afternoon, right, we can actually do an 11-7 breath and raise our energy a little bit to meet the present moment more head on.
Question on the
Yeah.
7-11.
Yeah.
So do you recommend doing that sitting, with the kids sitting up, or if they have the option to lie down? Like, is one way better than the other? Or?
Any way you want to do it is great. I mean, I think what's great about a lot of the practices that I like to share are that you can do it standing, you can do it sitting, you can do it laying down.
Is one more beneficial than the other?
I don't think so. I mean, laying down is always relaxing,
Yeah.
right? And that's, I mean, laying down practices are actually really great. You can also, I mean, you couldn't do this in a classroom necessarily, but if you're a yoga teacher, or if you're maybe a PE teacher, or certainly if you're a parent, having kids lay down and maybe put like a stuffed animal or a book on their belly and just watching their belly moving up and down, right? So you're getting that like visual feedback and the sensations at the same time, which all are just easier to focus on than just focusing on the breath when we bring awareness to the senses and sensations and all of that from breathing as well. So that's a nice kind of laying down breath practice. Yeah. So moving forward and thinking about brains, I want to say a few words about, how are we doing on time? Okay?
Yes.
Yes.
10 minutes.
About 10 minutes, okay. So I just want to say a few words about brains. When we think about like teenagers' brains or even younger kids' brains, like what are some of the things that come to mind, or what are some of the things we maybe worry about our kids as they enter the teenage years and get a little bit older?
Addiction to technology.
Addiction to technology, absolutely.
Self-esteem.
Impulsivity,
Self-esteem.
self-esteem,
Decision-making.
decision-making,
Consequences.
consequences, peers, yeah. Pardon? High-risk behaviors, something in the back. That whole frontal lobe thing. Yeah, that's just bad news, right? Yeah. Something's going on there or not going on there that we want to be going on there. So we have all these things we worry about as our kids get older, right? And we also have a lot of really exciting research. This is mostly by Sarah Lazar, who's right at MGH, like just across the river over here. She's been scanning the brains of people that meditate or practice mindfulness. And she's found some really cool stuff, which is that you can exercise your brain the same way you can exercise your body, which is basically like if if I go like this and I'm working out my body, then these muscles are going to be active and they're going to get bigger the more I do that, right? That's what's happening in the brain. We used to think the brain didn't change at all. The brain you're born with is the brain you have, pretty much. But we've discovered actually, and what's been really exciting is this idea called neuroplasticity, which is a big sounding word, but neuro means brain, basically, and plasticity means, it's something that can expand or contract and change. And so we can actually grow parts of the brain. So what Sarah found was that there's a few parts of the brain that even in just 8 weeks of practicing start to get bigger. We grow in brain matter. Our brains get bigger, and that's in the prefrontal cortex, the prefrontal lobes, which I've talked about. And that's a really important area because that's where, when the prefrontal lobes are a little smaller, that's where ADHD lives. When the prefrontal lobes are smaller, that's where high-risk behaviors are because that's where we are able to see the consequences of our behavior and plan for the future and things like that. So it's where a lot of like impulse control disorders like addiction or cutting or other kinds of high-risk behaviors take place because we can't see the consequences, and also it's where we suppress our impulses. That part of the brain is also a little bit smaller in people that are depressed, people that are anxious as well. So it's a really important part of the brain. It's also one of the last parts of the brain to develop. So that's part of the reason why we worry so much about teenagers. That part of the brain hasn't fully developed yet. But when we meditate, when we practice mindfulness, that part of the brain gets bigger. So it's really promising in terms of these practices being able to really change things like depression, like ADD, like impulse control problems, these other things that we tend to worry about in terms of our kids. And it's, as I said, it's one of the last parts of the brain to develop in terms of like our evolution, right? This is kind of what makes us human, this part of the brain. Separates us from animals. It's also the last part to develop in terms of, we used to think that the brain stopped growing around age 20 or so. And now we know this part of the brain, the prefrontal lobes, they don't finish developing until age 25. Anyone who's ever maybe, I think, we might not also be entirely surprised to know that for young men, that's more like 28 or 30, right? Car insurance companies figured this out before the neuroscientists did, or anyone who dated in their 20s probably figured it out before the neuroscientists did, right? So, but we can actually grow this part of the brain when we practice mindfulness. So that's kind of what's happening up front there, and then more in the middle, the slide is kind of hard to see. This is the insular cortex, kind of more in here. And this is where we do a little bit more of our social processing. This is where our mirror neurons are, where we can kind of see what someone else is feeling, understand what their experience is, have some perspective on the situation, right? It's an area that's smaller in people with bipolar disorder, smaller in people with schizophrenia, and bigger in people that practice mindfulness. So again, it's this other part of the brain that really changes, that grows. So what's cool about this research that Sarah did was she found that it's so much like a muscle. Right? These are the parts of the brain that are active when we sit down and we do something like that breath practice, and they also get bigger when we do that for even just 8 weeks. So we can really change our brains in this really exciting way. Yes?
And will it affect the bipolar disorder and schizophrenia?
There is a little bit of research on schizophrenia, and I don't know the research on bipolar disorder. There's a lot of really good research on depression. Yeah. And someone's probably doing that study right now on bipolar disorder.
So many kids in school being diagnosed now with bipolar. It's like,
Yeah.
the N-word or something.
Big time. Yeah. the really trendy diagnosis these days. Yeah.
This might be a question you can't answer, but so say the child has depression and is just not interested in meditation at all, then what?
So this is what's really tricky. So there's this great research on how helpful this is with depression, and as a therapist, getting depressed people to do anything is really hard. So figuring out how to tap into that motivation is a real challenge. And that's where, as a therapist, like I have to have really good buy-in, I have to have a really good relationship with this kid. But maybe it's not necessarily like the kid in a mindfulness group with me or doing mindfulness therapy with me. Maybe it's like them bringing mindfulness to their rock climbing that they already enjoy, or to yoga if they're able to go to that, or to something else in their life that they might kind of have some passion for, which of course passion is always lacking when we're depressed. But figuring out what it might be that we can kind of spark that kid a little bit. And there's also, in terms of getting kids to buy in, that's always the hard part. Getting adults to buy in is tough, right? But it is about thinking about, well, what's interesting to this particular, to my son or my daughter or this kid in my class or something like that, right? And so I used to actually keep a list of celebrities who, practice mindfulness and sports, and it's just, you just go on Google and be like, football players who practice mindfulness, and like a list of 10 people pops up, or like pop stars or whoever. And so, that's one way to get kids to buy in. Like the loathed Seahawks, of course, in New England, but like when they won the Super Bowl a couple years ago, like they're a team that practices mindfulness. There's a guy that, George Mumford, who's a local guy to Boston, he just wrote a book about mindfulness in sports. He's who taught the LA Lakers mindfulness practices.
Phil Jackson has a bestseller on it.
Yeah, and Phil Jackson, who coached the Lakers. Yeah, because George was like Phil's teacher. But there's all kinds of ways to think about getting kids to buy in. Or maybe for some kids, they want to do something about their stress. Maybe for other kids, they just want to stay calm with public speaking, which they maybe have to do, or be calm before the SATs or before their soccer game, or whatever it might be. We can think about what it is that's interesting to our kids, and then where mindfulness can maybe fit in to that. So that's a little bit just about the brain research. So just to kind of go back to thinking about, I threw out those ideas about what are the things we worry about with kids as they get older: impulsive, no perspective, decision making's not so good, right? All those things. And then mindfulness and meditation really appear to influence all those things that we tend to worry about. And again, sort of in terms of attention, that selective attention, can I pay attention to what I'm supposed to be paying attention to? And that sustained attention, right? Can I keep my mind on this particular thing in this moment? So that's also kind of what's happening in terms of the brain, in terms of concentration. But things like creativity, memory, other aspects of learning, all kinds of benefits to health and mental health, as well as to learning in the classroom. The other exciting thing about neuroplasticity, which is this idea that we can grow our brains, basically, is that the research has found that when we teach kids about neuroplasticity, there's a study a few years ago at Stanford where they give one group of kids some basic study skills, another group of kids some basic study skills, plus a lesson on neuroplasticity, that they could change their brains and make themselves smarter. And what they found a number of months later was that the group that learned that they could change their brains were working harder and doing better in school. Just by learning if I work hard, I can make myself smarter, and getting out of that kind of identity of I'm the dumb kid, or I'm the ADD kid, or I'm the special ed kid, or I'm the depressed kid, or whatever it is. They were able to really kind of change their mindset when they learned that they could change their brains. So it's exciting for kids, and they like learning about their brains. They like learning that they can change how they feel, that they can really do something and be empowered. And to me, that's one of the best things about mindfulness, is kids feel empowered. Oh, I can help myself feel better. Oh, I can help myself concentrate a little bit more. It's not some adult telling me to pay attention. It's me teaching myself how to pay attention. It's me helping myself feel better and soothe my difficult emotions that I'm experiencing in this moment. That's really empowering for kids who, they like to tell us how disempowered they feel all the time and how unfair life can be. So I know I did some breath practices, and I also said that breathing is played out for some kids. So why don't I close with one different kind of practice, and then maybe we'll do a little Q&A. So let me find always got to have a bell with me. So let's do actually a listening exercise rather than a breathing exercise, because sounds are also always with us. Can I have your eyes open or closed? I'll ring the bell. Just paying attention, the middle and end sound of the bell. Now let's start by just listening to any sounds that are far away, maybe sounds coming from outside the room. And let's move a little bit closer to sounds inside the room, further away from us. Closer still, let's listen to sounds near us. Maybe the sounds that our bodies are making, rustle of our own clothing, sounds of our own breath. And also noticing sounds as they land on our body, vibrate. If it's possible, tuning into sounds from within your body. Aware of the sound of your own thoughts as they just arise and pass. Bell again, and again just listening to the beginning, middle, and end of the bell. Opening your eyes and bringing your awareness back outwards. Got a few minutes for questions.
I've worked with students who are on the spectrum, and
Mm-hmm.
just wondered if you could speak to that a little bit, and just the socially and the anxiety.
Absolutely. The question was about someone who works with kids on the spectrum, on the Asperger's spectrum or the autism spectrum. I can actually just quickly get a show of hands. Who here's a parent? Who here's an educator? And I know some people are both. Who here's a therapist? Musician? Who here's feeling left out? You are?
I'm an epidemiologist.
Epidemiologist. Okay, great,
I work
great.
in neurology.
Oh, fantastic, great. So the question was about Asperger's and spectrum kinds of kids. This is a question I get a lot. I'm not an expert in that particular area, but I do know in terms of executive function, there's a lot of great research. I know that who I work with a lot these days are occupational therapists. And OTs are really excited about mindfulness and bringing it particularly to kids with sensory integration issues and kids on the spectrum as well. As far as social kind of issues go, there's a book that came out about a year ago by a woman named Irene McHenry, and it's called The Mindfulness and Autism Playbook for Teens, or something like that. That's worth checking out. She's a mindfulness and Quaker educator, and she's part of an organization I'm on the board of called the Mindfulness and Education Network. Her name is Irene McHenry. Yeah, I can write that on the board, people. I feel like there should be, like, Matt Damon should come in and solve some problem up here. Any other questions? Yeah.
You showed a Venn diagram of the stress response. Is that yours, or do you get
That's
sourced
mine. Yeah, and if people are interested, you can email me. I'm very Googleable. So if you want, you can I have a sort of ridiculous email address, which is, actually, you know what, I'll just skip to the slide that has it on it. I respond to all emails, and if people want a copy of the slides, I'd be happy to share the slides. You can see all the slides I didn't get to today. So it's chris@drchristopherwillard.com. Yeah, and there's my baby. Yeah, he's awesome. Yeah. Another question.
One of my questions goes back to, you were talking about the most stressed group of people is teens and then kids. What's the cause? What's happening?
The question was, what's the cause in terms of why are teens and kids so stressed out? I mean, to me, I think part of it's that adults are stressed out. And what we know is that what's really exciting is there's a lot of research on social contagions and how emotions kind of spread. The epidemiologists can maybe speak to this, but how emotions are really spread from person to person. So when adults are stressed out, the kids they're with are going to be stressed out, whether it's teachers, whether it's parents, whether it's other people in the kids' lives. That's a big part of it. We're also putting more pressure on our kids, right? I mean, like, I go around giving these workshops, and someone was an educator, and they were saying, in my school, they just cut lunch from 21 minutes to 17 minutes. And it's like, that's when kids, and then like they're, the kids, like, they're just trying to eat in that time and social, there's so much less time for rest, whether it's mindful rest or just any kind of rest and play and recess, there's less of that. We're also kind of cutting out social, emotional curriculum in some ways from, teaching kids just how to relax, how to play. And so we're not giving them the skills that they need to handle that stress. And we're loading on things like standardized testing, whether it's like, in the suburbs, and I have a private practice out in the suburbs. There's a parent in one of those towns that begins with an N, which I won't name, in the western suburbs, and she had her son scheduled into 15-minute increments every afternoon. He was 16 years old, and she was like, when does mindfulness fit in? And I was like, forget mindfulness, like, stop overscheduling your kid. I mean, but it was like, but that's the kind, I think that, and that's an extreme example, but I think there is just like so much overscheduling for so many, sort of like of the suburban kinds of kids. And then other kids, like when I worked in inner city Boston, it was like, they're being like raised by violent video games inside or like gangs on the street outside. And it's like, and, so kids are just under a lot of different kinds of stress in a way that they didn't used to be. I think, when I was a kid, I could play after school. I think social media and kind of digital stuff, I think technology can be wonderful. Like, I love my iPad and my iPhone and my iPod, like all that stuff, and I really enjoy social media, but it's like, it used to be that like the end of the day, like 3 o'clock, I'd come home from school and put on sweatpants and like eat popcorn, and now it's like, have to like look good on, my Instagram before I go to bed, and have to look good here. And so there's like this different social pressure where everything is public. You absolutely can't hide. So there's social stress at the same time. And then I think also it's tied in with things like bullying. I got really, this idea that the stress hormone and the love hormone are kind of contraindicated. I think that really is interesting. It's like, oh, I wonder why there's bullying happen when kids are so stressed out. It's like because they don't have any room for compassionate or be nice to each other sometimes in some of these really high pressure environments. Again, whether it's like a high pressure suburban school or whether it's like a really stressful neighborhood environment for some kids in a different setting. So there's a lot of reasons.
So based on what we know about early childhood intervention,
Mm-hmm.
the critical time period there, and knowing the stress level where kids, would there be a logical connection that we would start in utero?
Well, there's a great book on mindful birthing, but yeah. But I do think, and I mean, to me, that's why mindfulness is so great. It's like a skill we can teach kids, like when they're 3 or 4. Just teach like a hot chocolate breath or like the Hoberman sphere breathing or something like that. And it's like, the 5-year-old will do the hot chocolate breath, and then their hands fall away when they're 10, and they're not having to be like this. And then when they're 15, like they're not having to imagine the hot chocolate. They're just knowing what that kind of breath pace is like. So it becomes internalized, and we're giving kids a skill they can use across the lifespan. Because no matter how hard we try to protect kids, it's like they're going to skin their knees, they're going to get their hearts broken, they're going to fail a test at some point in their life, and to give them some resilience. And to me, mindfulness can also really build some of that social resilience, that emotional resilience, that psychological resilience that they'll need in a challenging world, in a stressful world.
This might seem that I'm totally ignorant about this, which actually, yeah, but I'm very interested in trying to learn more and more. But I have a question And
Mhm.
in the moment of the exercise, of the meditation, so
Mhm.
we arrive to the, with the breathing, and we arrive to the be present where we are, and then what?
Well-
And I am sorry because this is that it? I am trying to
I'm
actually.
gonna talk about that.
Do you want to say a few words
Yeah,
about
if you
that?
want, I mean,
or
if you,
will that roll
just,
into
yeah,
your...
would that be okay?
I mean, to me, it's about being able to shift into that place. It's like not being the dog all the time. It's not being like this all the time. If I'm walking around like this, like I'm not a monk, right? Like I can't walk around like this all the time because like I do need to plan, dinner for my kid, and I do need to drive in, on 93, and that totally sucks, and like all that stuff, right? So like, but it's can I get home from work and I'm like this when I'm home from work? Can I shut it off? And that's what's real, and that's like where like if my brain is like this from a really stressed out day, then I forget how to shut it off. So deliberately doing one of these practices that allows it to shut off, then I can really be present for my wife. I can really be present for my kids. I can be present for my patients in a different way. Or our kids can show up present. And then get into the mode where they're like, yeah, I gotta plan my homework or do whatever. So it's being able to access the present moment. Not necessarily having to be perfectly present like that all the time, but just more present. Like we could use more of that in our lives.
I think if you practice for long enough and then you have a bad week and you totally lose it, you'll start to notice how much it actually affects you.
Yeah. So she was saying kind of over time it becomes a practice that you can start to notice how it's affecting you. And yeah. Should I take one more question? Yeah.
I know I came in late, but.
Well, then I won't answer your question.
But you probably answered it, but the difference between mindfulness and meditation, I'm not quite clear.
So the question was about the difference between mindfulness and meditation. So mindfulness is I think of meditation as being like physical exercise. And there are different kinds of physical exercise. Mindfulness is one form of mental exercise. Meditation is mental exercise. Mindfulness is one form of mental exercise or one form of mental awareness or attention. So we can have like concentration meditation where we're just sort of focused on one thing in a sense, and that's almost like strength training, right, in the physical sense. We can have mindfulness, which is more of like an open awareness, and that's maybe more like yoga or some sort of flexibility-based training in a sense. So to me, there's sort of this kind of parallel between physical exercise and mental exercise. There's mindfulness practice, there's compassion practice, there's equanimity practice, there's different kinds of practices, just like there's stretching and there's cardio and there's whatever. Yeah. All right, well, thank you all very much. Feel free to email me if you have any questions.